I know it's been a long gap of time since we last talked, but again I repeat as a rule. Let's today's episode begin with a new wave of information related to our last ongoing topic, injections. And today we gonna talk about more of them, so let's commence the conversation. Welcome all to Is Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? So lend me your ears for a while and let in the magic of knowledge. Today's list begins with intramuscular injection, and as the name indicates, it is administered in deltoid or gluteal muscles. And yes, sometimes vastus muscle of the thigh may too serve the site of this injection. These are actually all large skeletal muscles. Their characteristics is rich blood supply and rich nerve supply. Due to these characteristics, mild irritable drugs could be injected and their absorption is also very fast. To your utter delight, I should tell you that this type of injection is actually less painful, but never try to self-inject yourself, please. That's a golden advice. Drugs should be given as aqueous solutions or depot preparations. Also, the former, they are quickly absorbed, while the latter, they are lately absorbed. The concept of depot is that the vehicle in the depot preparation is non-aqueous. A very good example to quote here is of the polyethylene glycol. This helps the drug to settle at injection site only, while the vehicle, it diffuses out. The drug provides a slow, sustained effect. Avoid giving such injections in patients on anticoagulants, as it may turn out to produce some problems like local hematoma. Now let me quickly enlist the advantages of such type of injections. Yes, both the plus and the negative points go hand in hand. Let's highlight the positive ones. 1. Predictable absorption. Yes, you can easily predict the absorption of such type of injections. 2. Ability of having given depot injections. That I told you before only, depot injections can be given very easily via intramuscular route. And yes, there's a set of disadvantages too on my list, which need to be known much importantly. 1. There is a dire need of perfect aseptic conditions. Yes, you have to maintain a good hygiene and aseptic environment. 2. There are great chances of nerve damage, and there may be another chances of abscess formation at the injection site. So be careful all the time. 3. Never try to administer large volumes via this route. Okay, the ideal volume is actually only 5 ml. Not much. Got it? Now, it's the good gracious time to know the examples for this particular intramuscular route of injection. Many antiemetics, antibiotics, testosterone depots, neuroleptic depots, and specifically I want to highlight the drugs like perfenazine and haloperidol for the depot injections. Then one important good point for this particular type of injection is that systemic effects, they are nicely achieved via this route. Next, I want to comment about the intradermal injections. The route involves injection into the dermis. It's a more vascular layer of skin under the epidermis. I'm sure you know that. Now, what is the procedure? Let's dive in that. A bleb is raised. Well, you can do it while putting the intradermal tip of the injection and raising the bleb, B-L-E-B. Now, you remember your BCG vaccination, capital BCG. And also, for your knowledge, I want to tell that sensitivity testing is also done via this particular route. If you don't want to raise a bleb, then another way is the multiple puncture or scarring through the procedure of the drug drop. But such a method is not very common and it is reserved only for some specific cases. I hope you're getting the important points for this particular type of injection. Small amount of drugs, they are given, especially I'm talking about the agents for the diagnostic, determination and desensitization. Such type of agents, they are preferred via this route. Now just guess the name of the syringe which you can use for this particular route. Yes, it's guess the name game. And yes, you are right. It's the tuberculin syringe. Now with this guess the name game, let's draw the curtains down for the day. You know, it was a great time delivering my words straight via your earbuds deep into the mesh of your minds. Now, does that beat up the drums for today's farewell? Hope you had a blessed, loving weekend and a great, memorable Sunday. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you are listening for the first time, do follow me whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.